Hello and welcome back to another medical assisting review video. In this video we'll be covering part 2 of the information that we left off on. Again, this is guidelines for providing emergency care, how we operate as medical assistants during an emergency when it's time to provide first aid or perform emergency medical procedures. Part 2, let's go. Guidelines for providing emergency care. Must have the patient's consent before administering emergency care. We're going to call that informed consent. Okay, that type of consent is basically you let the patient know what you're there to do, how you plan to help them, what the risks are, what other alternatives are, and then they make an educated decision from there. During emergencies when the patient cannot give you consent, but it's assumed that you would want these things done for you in an emergency, we're going to call that implied consent. Okay? Consent is assumed when a life-threatening condition is present and the patient is unable to give consent. For example, an unconscious patient, you should assume the patient could give consent if he or she, if the patient, they would give consent if he or she could. Always try to follow OSHA standards to reduce or eliminate exposure to bloodborne pathogens and OPIM. A reminder, OPIM just stands for other potentially infectious material. It's just everything that could be infectious that's not blood. You should know how to activate emergency medical services, which is the most important step in emergency care, providing a way for more advanced care to get to that patient. In an emergency, do not move the patient unnecessarily. We want to avoid causing further injury or making a life-threatening movement to the patient. For example, if they had like a fractured cervical vertebra or a fractured any vertebra, we wouldn't want to necessarily move them. You should try to obtain information as to what has happened from people like the patient. Okay, this is called establishing a history. Family members, co-workers, bystanders, anybody that was a witness to whatever events went on, you want to build a timeline of events. What had happened? We think of these as the events leading up to the incident. You should look for a medical alert tag on the wrist or neck. These look like little metal bracelets or necklaces that are on a wrist or neck, and they would give you information on if the patient's, for example, diabetic or if they have a cardiac history. I've even seen them that are look like a parachute cord bracelet that has a small little USB drive embedded in the buckle, and you can use that to upload it onto a computer and look at their medical history. You want to look for those medical tags. They'll tell you more about that patient. You should continue caring for the patient until more highly trained personnel arrive. On their arrival, you should relay the following information: the condition in which you found the patient, and the emergency care which has been administered, so that they can take over and provide appropriate care from there forward. On these following slides, we're going to talk about the different types of medical emergencies and what a medical assistant can do to try to treat these or at least provide care until more advanced care arrives. Respiratory distress. Respiratory distress is the patient is breathing but having great difficulty in doing so. This looks like labored breathing. This may lead to respiratory arrest. Respiratory arrest is, of course, stopping breathing altogether, whereas respiratory distress is having trouble breathing. Signs and symptoms of respiratory distress: noisy breathing, gasping for air. Gasping is an abnormal breathing. It is abnormal breathing. It's not normal. It would be breath only going in. Think of a fish out of water when you think of gasping for air. Rasping, gurgling, or whistling sounds indicate that there's airway obstructions or other things affecting the airway. Breathing that is unusually fast or slow. Recall that the reference range for adult respirations is between 12 and 20 at rest. Painful breathing. The general care for this patient. We want to put them in what's called the recovery position. This is just simply a comfortable position that facilitates breathing. Sitting is okay. More often we like semi-reclining. Legs at the same level as their butt, so legs supported on a table, and we want them leaned back at about 45 degrees. We don't want them flat. When we lay somebody flat, their abdominal organs push up on their diaphragm, making it more difficult to breathe. We also don't necessarily want them completely seated erect, as in seated at 90 degrees. That may also put pressure on the diaphragm, making it difficult to breathe. We like the semi-reclining, or what's called the semi-Fowler's position. It's important for you to remember that your facial expressions, your attitude about things, the way you talk, the patient can see all of that. Okay, and if you look frantic or scared, I bet you that's going to make your patient feel scared or anxious. It's important for you to remain calm. Okay, that's a hallmark of somebody who can handle an emergency, but they stay calm in the emergency. And the way you do that is by knowing what to do. Okay, knowing the steps to take. Knowledge can help prevent you from having anxiety during an emergency. So paying attention during these lectures, that's an important thing. Other general care. You should help reassure the patient to reduce anxiety. I will never tell a patient that everything's going to be fine, but you can tell them you're going to do everything you can in your power to help them, and you'll give them the best care that you can. Okay, this can help the patient breathe easier, and we want to try to work with them to relax their breathing. And if conditions worsen, we contact EMS. Of course, in the medical office, there are things we can do. We have nebulizer treatments. We can give we can give inhalers. Okay, we can administer inhaler breaths, nebules as well. We can administer oxygen, and during respiratory arrest, we can administer rescue breathing by way of a bag valve mask. So there are steps we can take to care for these patients in these emergencies. And you'll definitely need further training by your medical office on the things that you would do. And also recall that we learn these things when we learn basic life support, on our first exposure into the medical field. Asthma. Asthma is a condition characterized by respiratory distress. Those types of respiratory distress can be things like wheezing, coughing, or dyspnea. Dyspnea is the abnormal breathing associated with breathing very slowly. During an asthma attack, our breathing tubes are called bronchi or bronchioles. Bronchi are the larger ones. Bronchioles are the smaller tubes that are getting to be more microscopic. Of course, here in this analogy, think of a tree. Trees have branches. Bronchioles are the smaller branches. Our breathing tubes, our bronchioles, can either do one of two things here. They can constrict. The smooth muscle surrounding all of our breathing tubes can contract, and cause constrictions on the breathing tubes, our bronchioles, or they can secrete mucus and actually become clogged with that mucus. This can occur at any age, but of course asthma is more common in children and young adults. If asthma is not treated, it can lead to serious complications like lung damage. We think about things like allergies when we think about asthma. Some allergen irritating the lungs and the body responding more severely than it otherwise would in somebody without asthma. Some allergens that can trigger the attack: dust, pollen, mold, animal dander. These impurities in the air can trigger reactions. As well, think about the things that you deal with in daily life: air pollutants, okay, tobacco smoke, chemical fumes, or just simply vigorous exercise. Somebody who's asthmatic and undergoes vigorous exercise may experience an asthma attack. This can also be caused by respiratory infection, exposure to extreme cold, or emotional stress. It's usually controlled with medications to help breathing easier, either medications that reduce the mucus or reduce the constriction, stopping muscle spasms and opening the airways. Status asthmaticus is the medical definition for a severe, prolonged asthmatic attack, and this can be life-threatening, and in which the patient's only able to move a small amount of air. Symptoms associated with status asthmaticus: breathing may not be audible. They may display a cyanotic appearance, that is bluish discoloration of the skin, and they may display extremely labored breathing. These are the signs associated with signs and symptoms associated with status asthmaticus. This would require immediate transportation to an emergency care facility. Emphysema. Emphysema is the medical condition associated with trapped air in the lungs. Well, we think pulmonary emphysema, trapped air in the lungs. It's a progressive lung disorder in which the terminal bronchioles, again, go back to the tree analogy, the terminal bronchioles are basically the last little branches before you get to leaves. These are the bronchioles that lead to the alveoli and do have some air exchange, and of course the air has to get through them to get to the alveoli. These become plugged with mucus. The alveoli become damaged, and you actually, many alveoli become a large alveolus, and that causes a loss in surface area and a decreased ability to diffuse oxygen and carbon dioxide across those membranes, and air becomes trapped in the lungs because of those things. The alveoli will lose elasticity, and again, air becomes trapped in the lungs. Exhalation is difficult. Emphysema is not an acute condition. It's a chronic condition occurring over many years, and it's very frequently associated with heavy smokers. It also occurs in patients with things like chronic bronchitis, lung infections, or elderly patients who have lost lung elasticity. Chronic emphysema, one of the major causes of death in the United States. The lungs progressively become less efficient, breathing becomes more difficult. Patients in advanced stages may go into respiratory or cardiac arrest. Hyperventilation. Hyperventilation is overbreathing or breathing too quickly. For reference, the reference range for respirations is between 12 and 20 respirations per minute at rest for an adult. Respirations will become rapid and deep, causing the patient to exhale too much carbon dioxide. Often the result of fear and anxiety, and more likely to occur in tense and nervous individuals. Also caused by serious organic conditions, such as diabetic coma or pneumonia. Pulmonary edema, pulmonary embolisms, head injuries, high fever, and aspirin poisoning all can cause this condition of hyperventilation. Symptoms associated with hyperventilation: rapid and deep respirations, as we said, dizziness, faintness, lightheadedness, visual disturbances, chest pain, tachycardia is a rapid heart rate, palpitations, irregular, very noticeable heartbeats, a fullness in the throat, a numbness and tingling of the fingers, toes, and the area around the mouth. Patients complain they cannot get enough air. They often think they're having a heart attack. If we can get them to stop the hyperventilation, retain carbon dioxide, lots of these symptoms go away. So the treatment: calm and reassure the patient. Encourage the patient to slow respirations. This will help the carbon dioxide levels return to normal. If we suspect something like diabetic coma or pneumonia, these organic problems, we should contact EMS immediately. heart attacks, also known as myocardial infarctions or MIs, are caused by an obstruction to one or both of the coronary arteries or branches. These, of course, are the arteries that feed the heart muscle, the myocardium, and they can become blocked or obstructed, as they say, and that stops blood flow to the myocardium. Severity of the attack depends on the size of the artery obstructed or the amount of muscle tissue nourished by the artery. For example, a small branch obstructed, the myocardial damage is usually mild and symptoms would be mild, but a large obstruction would cause major damage and major symptoms. Severity depends on, again, the amount of muscle nourished by the artery. If the coronary artery is completely blocked, damage would be extensive and symptoms are intense. What are the symptoms? And these are the ones you definitely want to look out for. These are red flag symptoms for you, especially when you're doing things like, helping with triage of patients. Okay, something a medical assistant can do. Not independent triage, but assisted triage. Or just establishing chief complaints. Patients might not even recognize that they're having a heart attack. And they describe the symptoms, and you go, oh yeah, those are heart attack symptoms. So things like squeezing or crushing pressure, like an elephant is sitting on my chest. Worst chest pain I've ever had. Severe indigestion, burning, heaviness, or aching of the chest. The principal symptom is, of course, chest pain. These are descriptors. These are subjective descriptions of how it feels. Pain can range in severity from mildly uncomfortable to intense. Pain is felt behind the sternum, and it may radiate to the neck, throat, jaw, shoulders, and arms. Notice they say arms as in both arms, not just the left arm. Arm pain, radiating pain to these areas, and chest pain is a severe concern. If the pain is not relieved by resting or by administering nitroglycerin, which is an orally dissolved medication that helps dilate the arteries, the patient may become more severely ill. Other symptoms include shortness of breath, profuse perspiration, we call that diaphoresis, that is the profuse sweating, nausea, or fainting are also associated symptoms. If you, the medical assistant, suspect a myocardial infarction, if those symptoms are satisfied, we should activate EMS immediately. The first thing to do, of course, is to activate the appropriate emergency response for your facility, and that usually is calling for the doctor. Emergency medical services should be the first outside agency contacted. Loosen the patient's clothing. In fact, you should, in general, remove their clothing from the waist up and give them a gown to wear. Remove any metal from their chest, if possible. Place the patient in a comfortable position, something like the semi-Fowler's semi-reclining position. If cardiac arrest occurs, then begin your cardiac arrest algorithms. Assess for consciousness, assess for pulse and breathing, make sure EMS is on the way, begin CPR starting with compressions. Strokes, also called CVAs or cerebrovascular accidents. Strokes are the brain's version of a heart attack. Okay? It's when an artery to the brain is blocked or ruptures. This results in interruption of blood flow to the brain. Symptoms include sudden weakness or numbness of the face, arm, or leg on one side of the body. So what we think of is unilateral symptoms, symptoms that only affect one side, such as the face becoming droopy on only one side. Difficulty speaking, forming words, dimmed vision or loss of vision, and again, one-sided is a big indicator. Double vision is also an indicator. Dizziness, confusion, severe headache, worst headache I've ever had. That's the thing that goes to the hospital. Loss of consciousness. Evaluate them as you would start evaluating somebody for a cardiac arrest. If the medical assistant suspects a stroke, contact EMS. Again, activate the appropriate emergency response in your facility first. Usually that involves activating EMS right away. Loosen tight clothing. Have the patient rest in a comfortable position, again, usually semi-Fowler's. If respiratory or cardiac arrest occurs, begin those cardiac arrest or respiratory arrest algorithms. Administer care as required. Things like rescue breathing, CPR, or both. The next medical condition to be aware of is shock. We'll be describing all the different types of shock after we get done with this short slide series. Shock is simply the failure of the cardiovascular system to deliver enough blood to vital organs. This accompanies different types of emergencies, or can be all on its own. Emergencies such as hemorrhaging, external or internal, myocardial infarctions, or severe allergic reactions. If not treated, shock often is a life-threatening condition, and it can get worse, and it can be irreversible, and it can be to the point where the patient's life cannot be saved. Symptoms of shock. It's caused by, again, failure of vital organs to receive enough oxygen and nutrients. The organs most affected, irreparably damaged within minutes, 4 to 6 minutes, are the heart, the lungs, and the brain. Symptoms of shock include weakness, restlessness, and anxiety, disorientation, pallor or paleness, cold and clammy skin, rapid breathing, hyperventilation or tachypnea, rapid pulse. If not treated, this will rapidly progress to things like a drop in blood pressure, cyanosis or turning blue, loss of consciousness, or death in the most severe instances. Signs and symptoms can be either subtle or very pronounced, and no single symptom can determine the presence of shock or the severity of shock. To determine if a patient is shocked, you must consider the nature of the injury or illness. An example, the patient suffers a traumatic injury to the abdomen. Even if the patient's signs and symptoms do not suggest shock, it should be considered because trauma to the abdomen, we worry about internal hemorrhaging. It requires immediate medical care, and you should activate emergency medical response. In this section, I'll be describing the different types of shock. We describe the symptoms of all of these types and how to best treat this. So now we're going to describe the different types. Hypovolemic shock. Hypovolemic basically translates to low volume levels. This is caused by a loss of blood or other body fluids, either from external or internal hemorrhaging, or plasma loss from severe burns. Plasma, of course, being the fluid component of our blood. This can be caused as well from severe vomiting, diarrhea, or profuse perspiration. The first priority here, if we're suspecting external or internal hemorrhaging, is to do anything possible to try to control bleeding. Transport to emergency care as soon as possible, because the thing that's going to fix this one is to get fluid volumes back to normal. Cardiogenic shock. Cardiogenic shock is a failure of the heart to pump blood adequately to vital organs. This occurs when the heart has been injured or damaged, such as is the case during a myocardial infarction. Other causes of cardiogenic shock: cardiac dysrhythmias, CHF or congestive heart failure, acute valvular damage, or a pulmonary embolus. This is hard to reverse because damage to the heart. Because of damage to the heart is harder to fix. High fatality rates, 80 to 90%. Neurogenic shock. Neurogenic shock, the nervous system is unable to control the diameter of blood vessels. Normally, the nervous system instructs blood vessels to either constrict or dilate to regulate pressures. So, if you can't control your blood pressure, shock is an issue. In neurogenic shock, control of the blood vessels is lost, blood vessels dilate, blood pools in the peripheral areas of the body, and we worry about this when we worry about trauma to the central nervous system, brain and spinal cord injuries. Severe blood pressure drops uncontrolled. Anaphylactic shock. Anaphylactic shock is one I think more people are familiar with. This is a serious life-threatening reaction of the body to some kind of allergen, like drugs, penicillin, insect venoms, foods like peanuts, allergen extracts used in hyposensitization injections. The reaction causes release of large amounts of a chemical called a histamine. This dilates the blood vessels and drops blood pressure. Symptoms of anaphylaxis are similar. The initial symptoms are similar to basic allergic reactions: sneezing, hives, or itching, angioedema or blood pooling in the peripheries, or erythema, reddening of the skin. Disorientation, difficulty breathing, dizziness and faintness or loss of consciousness. The patient should obtain medical care immediately. Most fatalities from this will occur within the first couple of hours. What is the emergency care? It's administration of the right dosage of epinephrine. Epinephrine will constrict the blood vessels and raise blood pressure, increase heart rate. Highly allergic individual is provided with an emergency treatment kit, such as an EpiPen that they would keep with them, or oral antihistamines. Treatment can be started immediately. Psychogenic shock. Psychogenic shock is the least serious type, and it's the last type I'll be discussing. It's caused by unpleasant physical or emotional stimuli, such as pain, fright, or the sight of blood. This is the type of shock that I'm concerned with when I'm teaching venipuncture and I worry about my students fainting, or if I'm drawing somebody's blood in the office setting and I worry about them fainting. Psychogenic shock. This causes a sudden dilation of the blood vessels. Blood will pool in the abdomen and extremities, and it will temporarily deprive the brain of blood. This is where the loss of consciousness comes in from. Typical for the patient to be unconscious for a minute or two. This is more common if you have the patients in upright positions. So the fix for this, right? Well, let's look at some symptoms first. Warning signals, right? What is the patient going to look like, or what are they going to say? Sudden lightheadedness. They are pale, white as a ghost. Nauseous, if the patient becomes nauseous or weak. Yawning, blurred vision. The patient feels of warmth. Sweating, diaphoresis. What do we do? If we think somebody's about to faint, we want to facilitate blood flow back to their brain. So the patient should be put supine with the legs elevated above the heart. Loosen clothing. If they're, for example, seated in something like a venipuncture chair, we want to have them lower their head between the legs. And we want them to try to take the deepest breaths possible. In any case, the idea is get blood flow back to the brain. If the patient faints, so pre-syncope are the symptoms that we discussed. If the patient actually faints and becomes unconscious, we want to make sure they get into a supine position and the legs get elevated. And thank you. That'll finish part 2 of this multi-part series. Please check back for part 3.